Which of the following is considered a Schedule II drug? A. Alprazolam M. B. Hydrochlorothiazide, HCTZ. C. Ibuprofen. D. Acetaminophen. E. Excicodone or acetaminophen. The answer is E. Excicodone, acetaminophen. Schedule II drugs are monitored drugs that have an accepted medical use and are highly addictive, both physically and psychologically. Schedule II drugs include excicodone, acetaminophen, fentanyl, and hydromorphone. The nurse has just administered the first doses of the following medications. Which is most likely the cause of a new onset headache? A. Magnesium hydroxide. B. Sumatriptan. C. Pantoprazole. D. Metoclopramide. E. Sucralfate. The answer is C. Pantoprazole. The development of a headache is most likely a side effect of pantoprazole, a proton pump inhibitor. Sumatriptan is a medication that is commonly used to relieve migraine headaches. Metoclopramide may cause restlessness and anxiety. Sucralfate may cause constipation. Side effects are rarely seen with magnesium hydroxide. They include nausea, constipation, and aluminum deficiency due to overexcretion via binding phosphate in the stomach. A nurse is preparing a client to receive pain medication to aid with the discomfort of labor. The client is being prepped to undergo a pudendal nerve block. The nurse will explain the effects of such a block. A pudendal block is responsible for which of the following pharmacological actions in regards to providing anesthesia during labor? A. A local infiltration of the skin around the vaginal opening to provide superficial anesthesia to the skin. B. A type of anesthesia block to provide total anesthesia to the entire area, injected into fifth lumbar space and may hinder the mother from pushing during the birth process. C. Provides complete anesthesia with injection into the subarachnoid space of the lumbar region of the spine. D. A block specifically formulated to block nerve impulses to the uterus to aid in mother to assist in pushing during the birth process. E. Provides relief of pain from an episiotomy, blocks nerve impulses associated with the vagina, the cervix as well as the perineum region. The answer is E. Provides relief of pain from an episiotomy, blocks nerve impulses associated with the vagina, the cervix as well as the perineum region. A pudendal block is a useful type of anesthesia often utilized during the second stage of the labor process. It provides anesthesia for an episiotomy performed in the perineum area. What is the purpose of Beer's criteria? A. To list inappropriate drugs for infants. B. To list inappropriate drugs for the elderly. C. To list inappropriate laboratory tests for infants. D. To list inappropriate laboratory tests for the elderly. The answer is D. To list inappropriate drugs for the elderly. Beer's criteria is used in medicine as a list of drugs that should not be prescribed in the elderly. These drugs can have potentially disastrous complications for older adults, including falls and other serious injuries. Older patients undergoing palliative care typically do not need to follow Beer's criteria. You are the nurse taking care of a patient who is being treated with oral vancomycin, an antibiotic, for Clostridium difficile diarrhea. Which of the following choices best describes the mechanism of action of vancomycin? A. Inhibition of peptide elongation. B. Inhibition of topoisomerase 2. C. Disruption of mycolic acid synthesis. D. Disruption of peptidoglycan cross-linkage. E. Inhibition of integrase. The answer is D. Disruption of peptidoglycan cross-linkage. The correct answer is disruption of peptidoglycan cross-linkage, as this is the mechanism of action of the antibiotic, vancomycin. Vancomycin has high clinical utility in medicine, as it can be administered orally to treat Clostridium difficile diarrhea, or intravenously to treat MRSA infections, among others. As such, it is important to be well aware of vancomycin in clinical practice. Inhibition of topoisomerase 2 is the mechanism of action of fluoroquinolone antibiotics, such as ribofloxacin. Disruption of mycolic acid synthesis is the mechanism of action of antifungal medications. Inhibition of integrase is the mechanism of action of some antiretroviral drugs, as would be used in the treatment of diseases like HIV. Inhibition of peptide elongation is the mechanism of action of macrolide antibiotics, such as azithromycin. You are the nurse taking care of a patient who is receiving an antibiotic, clindamycin, for the treatment of an oral infection. Which of the following choices best describes the mechanism of action of clindamycin? A. Inhibition of dihydrofolate reductase. B. Prevention of folic acid synthesis. C. Inhibition of RNA transcription. D. Blockage of peptide elongation by binding 50S ribosomesite. E. Inhibition of DNA diarrhea. The answer is D. Blockage of peptide elongation by binding 50S ribosomesite. The correct answer is blockage of peptide elongation by binding 50S ribosomesite, as this is the mechanism of action of the antibiotic, clindamycin. Inhibition of DNA diarrhea is one of the mechanisms of action of fluoroquinolone antibiotics, such as ribofloxacin. Inhibition of RNA transcription is one of the mechanisms of action of bacitracin, a topical antibiotic. Inhibition of dihydrofolate reductase is the mechanism of action of trimethoprim, an antibiotic that is often combined with sulfamethoxazole to inhibit folic acid synthesis. Prevention of folic acid synthesis is the ultimate mechanism of action of trimethoprim and sulfamethoxazole, both individually and when given together. The nurse is preparing to administer 250,000 units of medication to a patient. The ampule sent from the pharmacy contains 500,000 units per milliliter. How many milliliters should the nurse administer? A. 1.2 milliliters. B. 2.5 milliliters. C. 0.5 milliliters. D. 0 milliliters. The answer is C. 0.5 milliliters. Strength of medication equals 500,000 units per milliliter. Required dose equals 250,000 units. Milliliters of medication required equals 250,000 over 500,000 milliliters. Equals 0.5 milliliters. The nurse is preparing to administer 100,000 units of medication to a patient. The ampule sent from the pharmacy contains 600,000 units per milliliter. How many milliliters should the nurse administer? A. 2.4 milliliters. B. 0.2 milliliters. C. 2 milliliters. D. 1.5 milliliters. The answer is B. 0.2 milliliters. Strength of medication equals 600,000 units per milliliter. Required dose equals 100,000 units. Milliliters of medication required equals 100,000, 600,000 milliliters. equals 0.16 milliliters. Rounded to first decimal, it is 0.2 milliliters. The nurse is preparing a bag of heparin sodium solution with a mix of 120,000 units and 400 milliliters intravenously. At what rate should the nurse set the infusion pump if intending to deliver 1800 units per hour? A. 6.0 milliliters per hour. B. 7.8 milliliters per hour. C. 2.2 milliliters per hour. D. 1.3 milliliters per hour. The answer is A. 6.0 milliliters per hour. According to the question, 120,000 units is mixed in 400 milliliters. So 1 unit is in 400 over 120,000 milliliters. Hence 1800 units is in 400 over 120,000, multiplied by 1800 milliliters. Equals 6.0 milliliters. Hayden is a 9-year-old boy who has been admitted to the emergency room with a fever. He weighs 71 pounds. If the dosing guideline for acetaminophen is 10 mg per kg at 4-hour intervals, how many milligrams of acetaminophen should the nurse administer? A. 293 milligrams. B. 458 milligrams. C. 323 milligrams. D. 710 milligrams. E. 620 milligrams. The answer is C. 323 milligrams. 2.2 pounds equals 1 kg. So, 71 pounds equals 71 over 2.2. kg equals 32.3 kg. Prescription dose of acetaminophen equals 10 mg per kg. Dose required equals weight multiplied by prescription dose. Equals 32.3 multiplied by 10. Equals 323 milligrams. An infant on his 14th day of life enters the emergency room. He are tachycardic, has poor skin turgor, and is crying without the formation of tears. The nurse knows that this child is showing symptoms of dehydration. The doctor orders fluid replacement of 544 milliliters over 5 hours. What is the drip rate of the infusion? A. 110 milliliters per hour. B. 108.8 milliliters per hour. C. 175 milliliters per hour. D. 200 milliliters per hour. E. 54.4 milliliters per hour. The answer is B. 108.8 milliliters per hour. The question says, over 5 hours to give 544 milliliters. So, in 1 hour give 544 over 5 ml equals 108.8. An 11-month-old child weighing 8.6 kilograms enters the emergency room with symptoms of a severe respiratory infection. Her physician suspects bacterial origin and prescribes ampicillin. The guidelines state that ampicillin is to be administered as 50 mg per kg per day in a dose 6 hourly. Ampicillin comes in 250 mg IV solutions of 50 milliliters. How many milliliters should the nurse administer for each dose? A. 25.5 milliliters. B. 250 milliliters. C. 107.5 milliliters. D. 50 milliliters. E. 21.5 milliliters. The answer is E. 21.5 milliliters. Weight of the baby equals 8.6 kg. Prescribed dose of ampicillin equals 50 mg per kg per day. Daily dose of ampicillin required for the baby equals 50 multiplied by 8.6 mg equals 430 mg. Dose of ampicillin to be given every 6th hourly equals 430 divided by 4 equals 107.5 mg. According to the question, available strength of ampicillin equals 250 mg in 50 milliliters. That is, 250 mg is there in 50 milliliters. 1 milligram is there in 50 over 250 milliliters. So, 107.5 milligrams is there in 50 over 250, multiplied by 107.5 milliliters equals 21.5 milliliters. Evelyn is a 3-year-old girl who has been bitten by her family's dog. She has had an incision and drainage, I&D, of her left hand to prevent infection and she has been prescribed cefazolin. The guidelines for cefazolin are 25 mg per kg per day. Evelyn weighs 42 pounds. How many milligrams of cefazolin should the nurse administer daily? A. 524 mg. B. 367 mg. C. 819 mg. D. 475 mg. E. 1025 mg. The answer is D. 475 mg. 1 kilogram equals 2.2 pounds. Weight of Evelyn equals 42 pounds equals 42 over 2.2, kg equals 19 kg. Prescribed dose of cefazolin equals 25 mg per kg per day. Required dose for Evelyn equals 19.1 multiplied by 25 equals 475 mg per day. The nurse must administer 1 liter of sodium chloride solution over 8 hours. What is the appropriate rate in milliliters per hour that the nurse must set on the IV pump? A. 125 milliliters per hour. B. 150 milliliters per hour. C. 100 milliliters per hour. D. 200 milliliters per hour. The answer is A. 125 milliliters per hour. Required dose equals 1 liter in 8 hours equals 1000 milliliters in 8 hours. So, per hour dose equals 1000 divided by 8 equals 125 milliliters. The nurse prepares to administer naproxen to his patient. The physician has ordered 1,500 mg/day in divided doses. The medication label reads 1 tab equals 0.3 grams. How many tablets equal the daily dose of this prescription? A. 5.5 tab. B. 4 tab. C. 5 tab. D. 3.5 tab. E. 4.5 tab. The answer is C. 5 tab. Strength of 1 tab equals 0.3 grams equals 300 milligrams. Prescribed daily dose equals 1,500 milligrams. Tablets required equals 1,500 divided by 300 equals 5. The nurse administers 500 milliliters of piperacillin to a patient with an infection. It must be delivered over 2 hours. The 4 has a drop factor of 5. How many drops will fall per minute, rounded to the nearest tenth, drops per minute? A. 24.0 drops per minute. B. 18.8 drops per minute. C. 22.4 drops per minute. D. 20.9 drops per minute. E. 20.4 drops per minute. The answer is D. 20.8 drops per minute. Prescribed dose of piperacillin equals 500 milliliters in 2 hours. Equals 250 milliliters in 1 hour. Equals 250 divided by 60, in 1 minute. Equals 4.17 in 1 minute. Drop factor equals 5. Drops per minute equals 5 multiplied by 4.17 equals 20.85 equals 20.9. The physician orders digoxin 250 micrograms. The label states, 1 equals 0.25 milligrams. How many tablets will the nurse administer to the patient for 1 dose? A. 1 tab. B. 1.5 tab. C. 2.5 tab. D. 2 tab. E. 0.5 tab. The answer is A. 1 tab. Strength of available digoxin equals 0.25 milligrams. 1 milligram equals 1000 micrograms. So, 0.25 milligrams equals 0.25 by 1000 micrograms equals 250 micrograms. Prescribed dose equals 250 micrograms. Tablets required equals required dose, available strength equals 250 micrograms, 250 micrograms equals 1. The nurse reads orders set by the primary care provider. She has prescribed 6,000 units of heparin 6th hourly subcutaneous for the patient. The label on the heparin vial reads 1 milliliter equals 10,000 units. How many milliliters will the nurse administer to the patient? A. 0.8 milliliters. B. 0.5 milliliters. C. 0.9 milliliters. D. 0.7 milliliters. E. 0.6 milliliters. The answer is 0.6 milliliters. Available strength of heparin equals 10,000 units per milliliter. Prescribed dose of heparin equals 6,000 units. Amount of heparin that needs to be administered equals prescribed dose divided by available strength equals 6,000 divided by 10,000 equals 0.6 milliliters. The nurse prepares to administer medications to his patients. One order reads 0.4 milliliters of potassium iodide for expectoration. The label on the medication reads 1 teaspoon equals 325 milligrams. How many milligrams are contained in this dose? A. 22 milligrams. B. 24 milligrams. C. 26 milligrams. D. 30 milligrams. E. 28 milligrams. The answer is C. 26 milligrams. Available strength equals 325 milligrams in 1 teaspoon. So, 1 teaspoon contains 325 milligrams. Hence, 1 teaspoon equals 5 milliliters. 5 milliliters contains 325 milligrams. 1 milliliter contains 325 divided by 5 mg equals 65 milligrams. 0.4 milliliters contains 65 multiplied by 0.4 milligrams equals 26 milligrams. The nurse prepares an order of 600 mg ampicillin intramuscular 8th hourly. The medication is available in powdered form to be reconstituted with sterile water. The vial contains 2 grams ampicillin and instructs the nurse to reconstitute with 4.8 milliliters of sterile water to obtain a concentration of 400 mg ampicillin per milliliter. How many milliliters will the nurse administer per dose? Round to nearest tenth. A. 1.6 milliliters. B. 1.4 milliliters. C. 1.2 milliliters. D. 1.1 milliliters. E. 1.0 milliliters. The answer is B. 1.4 milliliters. Strength of prepared ampicillin equals 4.8 milliliters containing 2 grams. 1 gram equals 1000 milligrams, hence 4.8 milliliters contains 2000 milligrams. So, 1 milliliter contains 2000 over 4.8 equals 416.67 milligrams. Prescribed dose equals 600 milligrams. So, 416.67 milligrams in 1 milliliter. 1 milligram in, 1 over 416.67 milliliters. 600 milligrams in, 1 divided by 416.67, the whole multiplied by 600, equals 1.44 milliliters. Equals 1.4 milliliters.